This week's Ask Dr. Durie comes from a patient who's concerned about the results of MRD testing. He noticed that the MRD test showed a very low level MRD positive in the bone marrow after several months of treatment. And a very reasonable question, which he asks, is should he take new treatment? Should he take extra treatment? What should he do with this MRD positive result, even although it's at a very low level with just a tiny amount of myeloma protein left in the blood? And so this is becoming a more and more common question, and very, very reasonable, and it actually has two types of answers. And so the first answer is if you're on ongoing treatment and the level of the myeloma is continuing to drop month by month, this means that you actually have ongoing response, and it may be in the frontline setting you can continue with another month or two of induction therapy like a VRD or DARA VRD or something like that. And then in the maintenance setting, it maybe means that you could continue with treatment for a few more months, and you might ultimately become MRD negative. So basically, no change. Continue and see if you do get that MRD negative result over time. The second answer is if things have reached a stable point, no improvement, just continuing just at that low level with no further drop, this actually can be completely acceptable. Many patients do achieve a very, very low level, stable remission, excellent remission, VGPR close to CR, and this is highly acceptable. And so this can be maintained without pushing to take some extra aggressive new therapy. And in fact, what we recommend in that situation is that, you can save an additional alternate relapse regimen until we see indication of change in the opposite direction, and which could be months, maybe years, until we might see, okay, that very, very low level of protein is inching up a little bit or something else is changing, such that we need to consider another relapse treatment option. And so you can see that these are detailed points, and the bottom line is please discuss these types of issues with your treating doctor. And I would encourage discussions about two types of things. Number one, about the types of the testing. There are different types of tests, and you need to know the sensitivity level. But then also some of the other details in terms of your own treatment protocol. If it's reasonable to continue with your treatment or look to even stop the treatment or look to maybe change the treatment at some point in the future. But a very, very important point being raised by this questioner this week. Please discuss it carefully with your doctor.